When it comes to senior care, there is a lot of confusion out there. People worry about losing their freedom, spending too much money, or becoming a burden to their family. But many of these fears are based on outdated or misleading ideas. In this video, we are breaking down 5 of the most common myths about senior care and revealing the truth that can help you or someone you love make better choices. Myth number 1, needing care means losing your independence. A lot of people believe that accepting care means giving up control over your life. But the truth is often the opposite. Whether it is help at home or a move into a senior living community, the purpose is to support your independence, not take it away. If daily tasks like cooking, cleaning, or managing medications become difficult, those struggles can actually reduce your independence. They can lead to accidents, poor nutrition, and social isolation. Care services are there to help you overcome those challenges so you can focus on the things that truly matter. Take Maria Rodriguez, who is 82 years old and loves to paint. As arthritis made it harder to manage her home, she spent more time on chores and less time on her passion. But after hiring a part-time caregiver to assist with meals and light cleaning, Maria was able to return to her art. The support gave her back time, energy, and confidence. According to the National Council on Aging, many older adults who receive in-home care feel more in control of their lives. It is all about finding the right support so you can keep living life the way you want. Myth number 2, senior care is too expensive. Yes, some types of senior care can be costly, but it is not always as overwhelming as people think. Many assume the only option is a nursing home, which can be expensive. But care comes in many forms, and there are affordable options to consider. In-home care, for example, can be adjusted to fit your needs and your budget, and there are financial resources available. These include long-term care insurance, government programs, and benefits for veterans. Samuel Johnson, a military veteran, needed personal care after a stroke. He discovered he was eligible for aid and attendance benefits from the Department of Veterans Affairs. That support helped him hire a home health aide and remain in his own home, comfortably and safely. With careful planning and the right information, many families find that care is more affordable than they expected. Myth number 3, family can handle everything. Family caregivers often take on an incredible responsibility, but expecting them to manage everything by themselves is not realistic. Caregiving is exhausting, both physically and emotionally, especially over time. Research from the American Association of Retired Persons shows that more than 60% of family caregivers report symptoms of stress, anxiety, or depression. That emotional weight can take a serious toll. Professional caregivers can ease that burden. They offer reliable support, specialized skills, and give family members a chance to rest and recover. Most importantly, they help ensure that older adults get the consistent care they need. For example, the Chen family cared for their mother, who was living with Alzheimer's disease. At first, her daughters managed everything themselves. But the demands grew, and they became overwhelmed. Eventually, they brought in a caregiver trained in dementia care. This allowed them to share the responsibility, stay emotionally healthy, and still be there for their mother. Myth number 4, once you are in a nursing home, that is the end. Many people think of nursing homes as places where life just stops. But that is not the case. While nursing homes offer medical support for people with serious conditions, they also offer much more. There are rehabilitation programs, social activities, and therapies that help residents regain strength and maintain a sense of purpose. For some people, a stay in a nursing home is temporary. It may be just a stop on the road to recovery after surgery or illness. Residents also have legal rights. They can make decisions about their care, welcome visitors, and speak up without fear. Consider William Davis, who entered a nursing home after a hip fracture. He took part in a strong rehabilitation program and worked closely with physical therapists. After a few months, he was able to return home, stronger and more mobile than before. The nursing home was not the end for him. It was part of his path forward. Myth number 5. Senior care is only for the very old or very sick. Another common misunderstanding is that you only need to think about care when you are frail or facing a health crisis. In reality, planning early makes a big difference. Thinking ahead can help you stay independent and live the life you want. It might mean changing your home to make it safer, improving your health, or simply having honest conversations with loved ones about your future care preferences. Some types of senior care are helpful even for those who are healthy and active. Retirement communities often provide social events, exercise classes, and transportation. These services make life easier and more enjoyable. Eleanor Evans moved into a retirement community when she was in her early 70s. She was still independent, but she wanted to downsize and simplify her lifestyle. Her new community gave her the freedom to stay social, take part in new activities, and enjoy peace of mind, knowing care would be available if she ever needed it. The bottom line: senior care is not about giving up control. It is about making smart choices, staying safe, and protecting your independence for as long as possible. With the right information and the right support, care can help you live better, longer, and more fully.